Yeah.
Next on our schedule, Dr. Heather Gardner. I was very excited that we were able to recruit Dr. Gardner back to campus. So she is a UB alum, and she is the inaugural chair, Carl Granger inaugural chair to lead the Community Health Equity Research Institute. So very happy to have her here, and I will turn it over to her. Thanks, Dr. Gardner.
Thank you. Welcome, everyone. Bear with me 1 minute. It's my pleasure to be back in Buffalo and back here at UB after 20 years, and to be running the Community Health Equity Research Institute. So I'm here today to share with you some details about the Institute. Starting here with the vision really is to see health improvements across the Western New York region with a special focus on folks in the Buffalo proper, and on health inequities. So we perform research to advance understanding of the root causes of health inequities, and look to develop and test innovative solutions to eliminate those inequities in the region. Our guiding goals are to facilitate and expand multidisciplinary research focused on health equity and community engaged research, to provide training opportunities to our internal and external communities on health equity, health disparities, and community engaged research, and to partner with community to align research to the region's needs. So we have 5 pillars. The first is to support and promote health equity research, to engage multidisciplinary researchers, provide training on how to engage communities in an authentic way that works to develop and increase trust between UB and the communities that we're engaged with, nurture existing partnerships and build new ones, and then provide education in health equity research. So I'm going to talk a little bit about what we do under each one of these pillars. In terms of research, we've actually, I just got here, so I say we, the royal sense. Dr. Tim Murphy was directing this institute for the last 5 years since its founding, and he's done an amazing job at getting funding in order to do the work that we do. So the first is a P50 grant, which was, I'm going to talk a little bit more about that in a minute, and then we've had some conference grants as well. We also connect research teams with community partners. So if you're looking to get involved and with community engaged work, we're here to assist in whatever way we can. One of those ways is through research days that will be held sometime in the spring. So please be on the lookout for that. We invite community to present about their organization and their research needs. So that's a nice way to start meeting community-based organizations in the area, as well as other researchers who are interested in this topic. We also facilitate research collaborations, so not just with external communities, but internal collaborations as well. And we support health equity research in all forms. So however we can help in getting your research up and running here at UB, we're happy to do so, including presentations to departments and schools. And one of the things that we're really going to be hoping to do this academic year is to identify and appoint health equity champions in departments and units across the university. So if this is something of interest, please reach out to us. In terms of the P50 Center grant, it was unfortunately terminated in March, but has been reinstated. So in the first year, we had 18 applications from 14 departments and 8 schools, and we awarded funding to 4 teams. This year, we had 29 applications from 9 schools, and we've invited 11 to submit full applications, which will be due, I believe, at the end of September. And we'll be issuing another call for proposals in the probably early spring. So please be on the lookout for that as well. And it'll look, something like this. We also have a research fellows program, and it really is intended to bring all the folks together who are like-minded and are interested in this kind of work together to help with all of our initiatives. So if that's something that you might want to be involved in, again, please reach out to us. We also have been providing training on working with the community, and that can come in a lot of formats. So, we can meet one-on-one with you to just assist and advise on how to approach potential partners for collaboration. We are also currently working on a training module that will come out of the Institute and be available for anybody to take. There's the CTSI workshop series in health equity, as well as an invited speaker series that we will be launching this semester. And then we'll also at some point in this year be launching a university-wide special interest group in community engaged health equity research. And again, I invite you to be a part of that. In terms of nurturing community partnerships, we have a large number of existing partnerships that we will continue to take care of, but we're also looking to identify new opportunities for partnerships. And so if you do have some of those ideas, please feel free to share. We're always interested in hearing from you. We'll be engaging elected officials and leaders of local businesses and companies this year, as well as hosting a community-facing seminar series. Our hope is to establish community engagement hubs in neighborhoods across the city and the larger region as a place for folks to come and learn about research and hopefully become more engaged in the research that's going on. We also have an existing health equity ambassador program that we're going to kickstart. And the whole, this institute was a product of an existing community university government partnership that the two other organizations are the Buffalo Center for Health Equity, that's the community organization, and the Office of Health Equity, which is part of the Department of Health and has been codified into law. So they have to have that office as of, I believe, 2018 or 19. So we also do a lot of education and health equity research. One of the key things we'll be doing this year is a pretty large overhaul to the website. We'll include some resources about health equity and community engaged research, and we're working with the UB libraries to actually develop those resources now. The website will also include a list of potential funding opportunities for folks who are interested in doing this kind of work, as well as a repository of open access data. So ideally, the website will be your first stop for data and other information about health equity and community engaged research. We're also looking to secure some more training grants, incorporate health equity into the undergraduate experience in different ways. And at some point down the road, we will be working on certificate and master's programs, as well as doctor's programs in health equity. And before I move on, I just want to introduce and promote the Igniting Hope Conference, which is coming up later this month. We have a community day that will be held in Martin Luther King Jr. Park on Friday, September 19th from 5 to 8. And then we'll have the conference on September 19th, which is a Saturday from, I believe, 8 a.m. to 4:30 p.m. And the QR codes are here for you if you're interested in registering. We're also looking for volunteers for these events. If you have any interest in being a part, please reach out. And you have my contact information, as well as that for Shay Bronson, who is the program operations manager. And we look forward to getting to know you over the next semester or two. And that was probably faster than you intended. Oh, and you can only see my eyes.
And I just want to and I just want to thank you for that, because we are a little bit behind schedule, and I was actually just talking to Jennifer about that, who's going to present on laboratory animal facilities. So thank you, Dr. Gardner. And again, welcome back to TV. Super excited to have you here.
Thank you.